Great, thank you, Bridget, and welcome back, and welcome to all of you to the third of our three-part Social Determinants of Health Impact series. Again, my name is Justin Granat. I'm the Vice President of Healthbox, a HIMSS solution, and I'll be your host for this, this third of our multi-session program. The purpose of this program is to reinforce the burning platform on why social determinants matter, and which we might already intuitively know, but why taking action now and taking more action matters more than ever. As I mentioned, this is the third in our three-part series. Our focus for today, connected communities of care and bending the cost curve. Welcome back to the attendees that have been a part of all three sessions. I see a lot of folks we've seen before. We appreciate you coming back and look forward to continuing this conversation. I mean, you've already been introduced to one of our speakers today, Leslie Wainwright, who is the Chief Funding and Innovation Officer for PCCI in Dallas. She's joined today by her PCCI colleague, Tom Roderick, who is the Senior Director for Data and Applied Science. Tom and Leslie, would you mind quickly reintroducing yourselves for those who might not have been here for either of the previous sessions?
Sure.
Absolutely.
Tom, why don't you start?
Absolutely. So I'm an economist by background with experience in regulated industries, including utilities, finance, and relatively recently now healthcare. As mentioned before, I'm a Senior Director of Data and Applied Science at PCCI, which means I plan data science build, delivery, and maintenance strategy. I lead data scientists and I help with the development of data science solutions. And I was involved very deeply in all the COVID-19 work, which I know has been referenced in earlier webcasts. So currently I'm leading initiatives in our Medicaid Managed Care Solutions group. Among several initiatives, it also includes determining novel ways to measure community impact.
That's great. And Tom just celebrated his first anniversary with PCCI this past week. So we are absolutely thrilled that he's part of the team. And Justin, thank you for the nod. Yes, I've been part of all three of these series. And I've been so pleased with the follow-up and the reaction to our first session, which was on connected communities of care during times of crisis. We're still clearly in the midst of the COVID pandemic, and the disproportionate way that social determinants of health are playing into the overall vulnerability and responses to COVID-19 continues to be a very real priority. Last time we spoke about connected communities of care and the community health needs assessment, and it was very clear through that dialogue that there'd been one view around the role that a CHNA plays in understanding community impact, and then there's another role that it plays as we think about standing up a connected community of care. And today, of course, we're diving more deeply into the bending the cost curve discussion. So just thrilled to see, again, as Justin said, so many familiar names on the attendee roster. As it relates to my background, for those of you who've been on before, just very quickly, Justin had mentioned that I am the Chief Funding and Innovation Officer for PCCI, have a long history with other innovation and strategy organizations, SG2, RTI, International, and Avia, again, focused more on early stage and more emerging types of both digital and non-digital health delivery, healthcare delivery innovations. And my purpose on this trilogy and our work with Healthbox has been to really get the work that we've done around connected communities of care out in the hands and in the hearts and the minds and the souls of as many people as possible who are at any point along their journey in standing one of these type of very unique structures up. So again, just thrilled to be here.
Great, Leslie, thank you. And it's been probably a highlight of 2020 to see not only the work that you've done in Dallas, but to see the reception that we've had from health systems who want to do the same things. Mm-hmm. We're trying to figure out how to partner across their communities, and do good and do well while doing good. So last web session we focused on connected communities of care, and the CHNA. And for me, there were a few key takeaways. And one being that there are three core data requirements that all revolved around data. One being data granularity. Most CHNA data is analyzed and reported at the zip code level. And it's important to better understand gaps or needs that one needs to perform data analysis at the census tract, or better yet, even the block group level. People have significant differences across any zip code. I think that stands to reason. but it's, it's not something that everyone's really attempted or gotten comfortable with. The third is data refresh. CHNA is performed every 3 years, and even the best CHNAs have gone a little bit static, right? They're a little stale, in years 2 and 3. And that cannot be the case with a connected community of care. So a regular commitment to ongoing data acquisition is really critical. And then amped up social determinants. While social determinants is a component of the CHNA, the connected community of care work requires a heavier emphasis. So we know that COVID-19 this year has shown a light on the importance of social determinants. And we know that health systems have taken a significant economic hit, even despite all of the stimulus dollars they received, due to caution around elective surgeries, people avoiding hospitalization, or even just avoiding screening, avoiding their doctor's offices. And we've seen the backlog that we've had in so many cancer and cardiac specialties. So today we're going to talk about connected communities of care and how this concept and this model can help with management of the total cost of care. So this is for a lot of people where the rubber really meets the road, like, hey, we want to do the right thing, but can we have it make sense financially? So specifically, we're going to do a few things. One, we're going to remind all of our attendees what a connected community of care is. We're going to highlight some of the broad financial impacts that connected communities of care can have on cost. Discuss again why data matters. So we're thrilled to have time to help us out with that. And of course, we're going to open the floor for discussion. So as questions occur to you, please enter them. We'll do our best to get to as many questions as we can today.